The topic of presentation is circadian immunity and vascular inflammation in cardiovascular disease chronotherapy windows, time for a reassessment. The topic's research was conducted at Zhengzhou University. The topic Yan Zhang, the first author of this study, and it is my great honor to present this work to you. The topic suprachiasmatic nucleus, SCN, functions as the central circadian pacemaker, synchronizing peripheral immune clocks through neural, humoral, and endocrine pathways, including the HPA axis and glucocorticoid signaling. The topic together with external Zeitgebers, this system regulates clock-controlled gene expression rhythmic immune cell function, with important implications for cardiovascular health. The topic circadian clock operates through a clock, BMAL1, driven transcriptional, translational feedback loop, in which PR/CRY complexes mediate negative feedback, reinforced by REV-ERBα auxiliary regulation. The topic's core clock is functionally integrated with cellular redox signaling via the SIRT1 BMAL1 NRF2 axis, while oxidative stress feeds back to modulate clock stability, ensuring alignment of circadian timing with metabolic and redox homeostasis. The topic TLR signaling and NF-kappa-B activation are rhythmically controlled by the circadian clock. Surface receptors TLR4/5 signal through clock-gated IB and ADAM17, while TLR9 and TLR2/6 show clock-driven transcriptional rhythms. Circadian regulators SIRT1 I and RORγ restrain NF-kappa-B, whereas sustained NF-kappa-B feeds back to suppress BMAL1, promoting chronic inflammation. NLRP3 inflammasome activation is similarly timed, with REV-ERBα coordinating mitochondrial homeostasis via PGC1-alpha, SIRT3, and NRF1, so this control elevates ROS, driving inflammasome assembly, caspase-1 activation, and IL-1 beta/IL-18 maturation. The topic circadian BMAL1 and autonomic signals rhythmically regulate immune cell trafficking. During rest, neutrophils are retained in bone marrow, monocytes mobilize, lymphocytes circulate, and dendritic cells enter lymphatics. During active phase, these gradients reverse, ensuring temporal control of immune cell distribution and function. The circadian disruption accelerates atherosclerosis and stroke by impairing immune cell rhythms, promoting inflammation, endothelial and vascular dysfunction, and neuronal/glial injury. The topic MAL1/REV-ERBα/CRY loss enhances monocyte recruitment, NLRP3 activation, neutrophil and cell dysregulation, and leukocyte endothelial adhesion, while PER2 deficiency and clock disruption compromise cerebrovascular integrity. The topic changes increase plaque growth, infarct size, neuroinflammation, and long-term neurodegeneration and cognitive deficits. The topic in disruption worsens ischemic heart disease and heart failure by dysregulating immune inflammatory responses, metabolism, cardiac structure, and gene expression. The topic L1/REV-ERBα/CRY loss increases cardiac inflammation, disrupts leukocyte chemotaxis, oxidative stress, blood and vascular rhythms, and impairs cardiomyocyte metabolism and mitochondrial function. The topic structural remodeling, fibrosis, and maladaptive hypertrophy are promoted, while clock gene alterations influence infarct size, arrhythmia risk, and HF progression. Melatonin can partially restore cardiac function via autophagy, anti-apoptosis, and mitochondrial protection. The topic cardiovascular chronotherapy targets core clock components, inflammatory/redox pathways, and immune cell trafficking. The topic REV-ERBα/beta agonists, SR9009, SR9011, suppress BMAL1, inhibit NLRP3 activation, reduce M1 MAC polarization, limit hypertrophy/fibrosis, and preserve cardiac function in a time-dependent manner, most effective near REV-ERBα peak. The topic NLRP3 and NF-kappa-B inhibitors, MCC950, triptolide, mitigate inflammation, oxidative stress, and myocardial/vascular injury with efficacy enhanced when administered before inflammatory peaks. Modulating immune cell axes, CCR2/CCL2 inhibitors reduce monocyte infiltration, CXCL12/CXCR4 modulators and DPP4 inhibitors optimize reparative cell mobilization, also benefits cardiovascular repair. The topic aligning interventions with circadian peaks maximizes therapeutic effects. The topic cardiovascular chronotherapy aligns drug timing with circadian rhythms. Aspirin, colchicine, beta blockers, RAS inhibitors, TPA, melatonin, and SGLT2 inhibitors show time-dependent benefits. The topical studies highlight REV-ERBα agonists and NLRP3/kappa-B inhibitors, with peak-aligned dosing maximizing anti-inflammatory and cardioprotective effects. The topic evidence is limited, optimal timing remains unclear, requiring circadian-informed trials. The topic research show that circadian rhythms control the immune vascular axis, and disruption of BMAL1 or REV-ERBα accelerates cardiovascular disease through inflammation and immune dysregulation. The topic's rhythmicity supports chronotherapy, and preclinical studies show time-targeted REV-ERBα agonists are especially effective. Clinical trials are needed to optimize timing. The topic research show that circadian rhythms control the immune vascular axis, and disruption of BMAL1 or REV-ERBα accelerates cardiovascular disease through inflammation and immune dysregulation. The topic rhythmicity supports chronotherapy, and preclinical studies show time-targeted REV-ERBα agonists are especially effective. Clinical trials are needed to optimize timing. The topic